The Bedside Mobility Assessment Tool is a validated and reliable tool to assess patient mobility. It will now be a part of the daily assessment and incorporated into the new Progressive Mobility Protocol. Before proceeding with the BMAT, make sure your patient has an order for progressive mobility. Also assess your patient for any contraindications to mobilization. The first assessment of the BMAT is the sit and shake. This assesses patient's sitting balance and core strength. The patient should be able to sit upright without showing any signs of distress, such as tachycardia, diaphoresis, or dizziness. While assessing the patient during the sit and shake, the patient should be able to move from the center of the bed to the edge of the bed. Using the bed rail is acceptable. However, they should receive no additional assistance. Then they should reach across and shake with both hands. Patients who either cannot get to a sitting position or if patients lose their balance while shaking hands, they would fail this assessment and be a mobility level 1. Mobility level 1 includes mobility activities that should be done in bed. Mobile transfer lift equipment should be used, which includes cardiac chair, hover mat, and patient lifts such as the Golvo. The second assessment of the BMAT is the stretch and point. This assesses the patient's leg strength in preparation for weight bearing. This also can assess for foot drop. Test the patient's ability to stand on both legs. Only complete the assessment on one leg if the patient has a condition that precludes them from using both legs. While sitting unsupported, the patient should extend one leg and straighten the knee. The knee should remain below hip level. They should point toes and pump their ankle between dorsiflexion and plantar flexion 3 times on each foot. The patient's feet may either be flat on the floor or dangling. Observe patients for an inability to fully extend their leg. Ensure that this is a new finding and not the patient's baseline. If patients are unable to complete this, they would be a mobility level 2. Mobility level 2 includes mobility activities in the bed and the chair. Powered standing lift equipment should be used, such as the Sabina 2 or the Steady Aid. The third BMAT assessment, stand, assesses the patient's ability to shift forward, raise their buttocks, and rise smoothly. This tests their balance and their strength to rise off the bed and stand. With the patient's feet flat on the floor, about shoulder width apart, the patient should shift forward, raise their buttocks, and rise and stand upright for about 1 minute. The patient may also use the bed rail for support as needed. The patient may also use a walker to help them stand. Please note that the patient should use one hand to push off from the bed when getting into the stand position. Observe the patient for an inability to rise off the bed, either with or without a walker. If the patient is unable to complete this assessment, they will be a mobility level 3. Mobility level 3 includes mobility activities in the bed and the chair. One of the differences between mobility level 3 and mobility level 2 is the use of non-powered standing lift equipment. This includes the roll-on and the Sarah Steady. The fourth and final assessment of the BMAT is walk. This assesses the patient's ability to shift their weight and is a further assessment of their leg strength. To complete this assessment, have the patient march or step in place, taking small steps, 3 times on each foot. Once the patient completes that task, Have them step forward and completely shift their weight onto that foot. Then return the foot to the starting position and repeat with the other foot. A patient may use a walker or other assistive device to complete this assessment. If a patient is able to complete the assessment with their assistive device, they are a mobility level 4. Patients who pass all 4 assessments of the BMAT are a mobility level 4. Mobility level 4 includes activities for independent patients with minimal assistive devices. A walker, gait belt, or cane may be used by the patient. Observe your patient for any loss of balance during this assessment. If your patient fails this assessment, they are mobility level 3.